Well, hello everybody. Well, I'm in fantastic company yet again this morning in England, with some really formidable nurse leaders that work across the world to really prioritise nurse leadership and investment in early careers, nurses and midwives. We're anticipating some other members to join shortly, but we're going to make a start because of we've got to stick to time. But if we do have a glitch, don't worry, we're recording everything and we will be producing materials post the conference so nothing gets lost, because we have such gems within today that I wouldn't want anybody to miss it. In terms of this session, this is quite a hard-hitting session in some ways, because we've got really experienced nurse leaders with us on this session. And we really want to understand why they have chose to invest in the Nightingale Challenge and why they have become so passionate about early careers, nurses and midwives, and the difference that they can make. So it's absolutely, colleagues, real frank views about why you've gone for this and why the Nightingale Challenge means so much for you. So I'm going to start with Adela. Adela, from your point of view, why the Nightingale Challenge and what key lessons are you learning on this really exciting journey?
Well, first, thank you very much for inviting me to this celebration, and I want to congratulate you for all the work that you have done engaging nurses all over the world with the Nightingale Challenge. I am a fan of the program, and I think is good for the nurses, for the midwives, and also for healthcare. This morning, Dr. Tedros said that the governments, the organizations, they need to invest in nurses and midwives for the improvement in healthcare. And this morning, Lord Chris told us that now is the time. Now is the time. This is our time. I really believe on that. No, and we are having a really difficult time with COVID-19 all over the world, and right now in Brazil, in all Latin American countries, are having a really great impact, as well as in Spain. I'm working in a hospital, in a university hospital called Hospital Clínic of Barcelona, that is in the heart of the city. We had 2,500 COVID patients hospitalized, and we had to do a great effort. And thanks to all the nurses and other health professionals as well, no, that they did all the things possible to save lives, no? And the courage of our nurses, together with their knowledge and their commitment, was a good example of what is nursing. And to respond to this COVID-19 crisis in our hospital, we didn't have enough nurses, because in Spain we have a chronic shortage of nurses that has been documented for many years from the World Health Organization, from OECD statistics. Our government knows about that, but for many years, and especially after the financial crisis of 2008, we are having a really shortage of nurses. So we had to look for help from nursing students. So in our hospital, we were very lucky to get involved almost 1,000 nurses students that they were about to graduate, but thanks to their compassion, they're willing to contribute to the response of COVID-19. We were succeeding in the response in a very positive way. The lesson that we learned in that really important crisis that is similar in other Latin American countries, but because I've been speaking with them, with Mexico, with Peru, with people from Argentina and Uruguay, the teamwork that has been developed has been fundamental to respond to that crisis. So these are really essential values of nurses, and the Nightingale Challenge gets involved in this situation. We have the acknowledgement of the society as health workers vital to the response. However, we have a long way to go, because still in the media, in the society, they don't see us as leaders in healthcare, as experts in healthcare. They see us as health workers, vital, but not as a leaders. So the Nightingale Challenge is more relevant now than never before, because we have excellent nurses, very well educated, with degree levels, with master's degrees. Some of them, they do very good and relevant research.
Yeah.
And we are not acknowledged in that way.
Yes.
For instance, in our government in Spain, after this tremendous crisis, the government developed a committee for the post-COVID refundation of healthcare and social care. And a few nurses were invited to participate and contribute to that committee. So what we have done through leadership in nursing, following with what Annette Kennedy, our president of ICN, said, if they don't invite you, you have to take a seat in the table. So what we did is a letter, that the same letter has been sent to that commission about 50 times from all over Spain, from all nursing associations, from all nursing now groups, local, autonomous groups, and also the national group. And we sent the same letter asking the government really to what Dr. Tedros said, invest in nursing and midwife to improve healthcare. So really, we are very motivated to keep working with that positive vision, no? As part of the healthcare workforce, with physicians, with economists, with sociologists. So really, now is the time, like Lord Chris said.
Fantastic, Adela, and you just ooze energy and enthusiasm. And thank you so much for all of your leadership and commitment to the Nightingale Challenge. It's truly appreciated. Shall we move now to Peter? Peter, you're in America. I understand, if you're still in America. What have you learnt about sort of really putting the spotlight on early career nurses and midwives? And do you plan to continue to do this as part of your sort of strategy for leadership? I think we can't hear.
I am so sorry, I was muted.
Hi, Peter. No worries. It happens all the time.
Good morning. What a great way to start the day, talking about the Nightingale Challenge and talking about nursing. I'll be participating a little later on today on a session that's really focused on youth with the one of the Nursing Now campaign youth representatives, Minashi from Zimbabwe. But right now, I think what I would like to say is that, my perspective here comes very much from my work as a global health worker and supporting nurses in low and middle income countries across the world. And I think it's one of those things where truly, the more you look, the challenges that nursing and the nursing profession face are the same everywhere you go. Maybe different scope, but very much the same problems. So I think that this very much came out in our work on the recent State of the World Nursing Report that was launched on April 7th. And I think just coming from the very beginning, beginning of the process of looking at nursing from an educational perspective, from an employment perspective, from a leadership perspective, I think all of those impact on young people and young people's choice to, to select, select nursing as a profession. We need according to the report, we need 5.9 million nurses. Uh, but that, that number is not enough to really understand the complete, the complete phenomenon driving that need.
Yeah.
For one thing is that, I've learned through my work and talking to many young people in many countries that that nursing is often not their first choice of profession. Um, Many people go into nursing because it is seen as a job, and in some country contexts where public education is a one-time opportunity, they are, they're provided the profession as a, part of a, part of a range of opportunities that are selected to them. They may say, these are professions are rated, and if you are top scores, you go into engineering or medicine, and nursing is somewhere down the road there. So the value that nursing has, I think, in society,
Yeah.
and the perspective on nursing in society has a whole lot to do with the choices that are made. One of the things that I think came out of the State of the World Nursing Report was to try to really redefine the image of nursing for young people. Try to make it look more like science, technology, medicine, a STEM profession
Yeah.
that folks are going to want to go into. Um, we definitely want, we definitely want the best and the brightest. The other issue that we found is that nursing still is a very engendered female profession. 90% of people in the profession are women. But and even within the profession, there's a glass elevator for men in the profession. So I think we have to be very careful. Me as a man in nursing, I think I'm particularly sensitive to this. We want to make this more of a profession that is seen as as not women's work, but in important
Yeah.
work for everybody. But at the same time, we want to make sure that we attend to uh, to the the unique needs of women that are in the profession. There are there are employment issues with equal pay. There are employment issues with safety in education and the workplace. These things are critical. We saw this during the COVID period, where I think in some senses nurses were
Yeah.
crying out for personal protective equipment, and just not being heard. I think uh, I think it begs the question of of how much do we why do we not value the way that we should.
Yeah.
Um,
Well, that's great, Peter. I think the COVID has put the spotlight on it, and I think you're right. The image of nursing is something that we need to keep working on. But I think the Nursing Now Nightingale Challenge, when you listen to what nurses and midwives are doing and what they've done through COVID, that there is a golden opportunity. So yeah, absolutely.
I know my colleague at Howard Catton at ICN has said many times that he is not worried about COVID and nursing and raising the profile of nursing. I think this is raising the importance of nursing
Yes.
within the workforce. Yet, oftentimes, when particularly early in the pandemic, when we saw, at least here in the U.S., when we saw people, in the media talking about the problem, talking about the science, they went right to the physician.
Yeah.
They thanked the nurses. But they didn't invite them to that table
Yeah.
that we're talking about.
Thanks, Peter. More work to do. I'd like now to move to Abdullah. Hi, Abdullah. It's great to see you on the screen. Can you hear me okay, Abdullah? Yeah, great.
Yes, yes, we can
Well,
hear you.
the speciality hospital in Jordan was one of the early adopters of the Nightingale Challenge. Thank you very much. What do you see the key impact of the Nightingale Challenge being on your organisation?
Thank you so much for your dears at Nursing Now campaign for giving me this opportunity. My name is Abdullah Haimour from Jordan. I'm working as Chief Nursing Officer at a specialty hospital. Specialty Hospital is a private hospital in Jordan, Amman. Also, I was honored to be one of the participants in TOT of Leadership for Change.
Abdullah, sorry to interrupt. Is there any way you can turn up your volume at all?
Okay, is it good? You can hear
Try
me now?
again. Keep
Is it
going.
okay? Okay,
Carry on,
now it's
Abdullah.
okay. Is it okay now?
Yeah.
Okay. And again, I was involved in the Leadership for Change program and TOT for Jordan program for Leadership for Change in the previous 10 years. And that was very supportive for what pushing my career path, actually.
Mhm.
At the beginning, let me tell you a brief history about our journey with the Nightingale Challenge. Actually, the first contact with the Global Nursing Now Initiative Nightingale Challenge 2020 starts in 2019. That was through Lord Nigel Trust and through Dr. Ruwaid Al-Maait, advisor of Her Royal Highness Princess Muna, and through Dr. Fawzi Al-Hamoud, our general manager. He was very supportive. In
Mhm.
February 2019, a small ceremony from St. Thomas's Hospital in London with a small number of leading hospitals. Around 6 hospitals at that time was involved, including our hospital, was the first hospital to accept it in that challenge. After that, the participants of the Nightingale Challenge selected and started to be engaged in many activities. The first activity was in our hospital for Nightingale Challenge movies. I think you hear about the Nightingale Challenge movies. That was around 5 minutes, and we have around 15 seconds in this movie. And the speakers actually was the participants in the Nightingale Challenge, and it was very unique experience for them to speak in front of the camera. Then we adapt an exciting leadership and development program to help build the knowledge and skills of the future generation of nursing and midwifery leaders. The adopted training program worked to improve, develop, and leadership skills of the 20 interested young nurses and midwives. The main themes of the program was first lectures and group discussions held by the leaders from the different backgrounds and by the participants themselves. The focus here was to encourage the participants to be initiative and creative. The second part was for quality improvement projects for each 4 to 5 participants. We aimed
Mm.
here to focus on the knowledge of the participants and to let them know what are the priorities of the issues related to the nursing issues. In addition, we aim to teach them to follow through, to get their work or their projects to be completed and to see actual change. Other part was the hosting of one of the nursing leaders here in Jordan, well-known figures, to reflect a positive image of nursing, and this was very impressive and energetic for them. Another part mentoring for each participant by senior nursing manager, and the last part was shadowing with one or more of leaders like nursing leaders, nursing supervisors, policymakers, quality directors, and even clinical nurse specialists. They
Mm.
have to be with them for at least 7 days. This part
Wow.
gives, yeah, this part gives them the participants a clear idea of the actual problem-solving methods and what are the challenges and stressors they meet the leaders in reality. Jordanian nurse,
Fantastic, Abdullah.
yeah,
Are
mhm.
you reaping the benefits of this investment with these the young nurses? Because you've been going quite a long time, haven't you? Are you seeing any impact?
Yes, actually, yes, there's a big impact for them. Actually, one of the very energetic activities that was implemented at the beginning of this year was the team was participated in the Health for All Film Festival competition. We make a short 8 minutes movie talks, takes a story of the importance role of the psychiatric nurse specialist in dealing with one of the Syrian refugees victims. Our
Yeah.
film was actually nominated as one of the top 15 out of around 1,300 films at that time.
Wow. Gosh.
Yeah. Just
Fantastic.
at the end,
Could I just
just
say, Abdullah, do you plan to continue investing in early career nurses and midwives as a
yes,
result of
sure.
doing this work?
Yes, sure, sure. We will
Fantastic.
continue.
Well,
Okay.
thank you so
Just,
much.
just,
That's That's
Thank you.
brilliant. I'd like now to go to Debbie. Debbie is a good colleague of mine, actually from the UK, and has been doing some fantastic work on the Nightingale Challenge in Bradford, and also partnering with Kenya of all places. So, Debbie, if you could give us your highlights and I guess what you're learning and your plans for sustainability, that would be super.
Yeah, thank you, Lisa. Yeah, part of my role is around preceptorship for nursing. So I was really excited to learn about the Nightingale Challenge last year. We've got young nurses that come through our 12-month preceptorship programme from being newly qualified, and they go through that at quite a pace. Some of them move into junior leadership roles quite quickly due to the vacancies that we carry. And there's a concern sometimes that they don't actually have the right toolkit in terms of that resilience and leadership ability and skill. So with the Nightingale Challenge, it was a really good opportunity to do a bit of a learning needs analysis. So what were the gaps in terms of the next steps post-preceptorship for these young nurses? And as a result, we've come up with a blended programme which complements the preceptorship, but also kind of continues to invest in them, values them, and hopefully retains them within the organisation. Most of our Nightingale Challenge nurses are quite early on in their nursing careers, so around the 20-month period. So the programme that we've come up with has got a little bit of kind of formal modules that are part of our normal leadership offer, but also, heaven forbid, we put a bit of fun into it as well, to try and continue to engage them. So it's not all kind of, workshops and kind of studying type environments. To start with, we do a couple of modules from our leadership offer. So they do a module on leading a team, and they also do a module on leading organisational change, which is really good for them as a starting point. Then we have a workshop from a life coach called Tilla Brooke, who comes across from Leeds to do some work around how they can effectively facilitate learning as a leader. So looking at themselves in terms of how they learn, but then how they can engage with their teams and adapt their learning style accordingly. They all have one-to-one mentoring from members of our exec team. I think quite a lot of the Nightingale Challenge programmes have built in, which has been really important. It's obviously that's been slightly stalled because of the pandemic, but we're hoping to pick that back up again now. And then a really interesting part of our programme is our evidence to practice 2-day workshop that's facilitated by our library and our research and development service. So they bring to the session a chosen topic, and then they have 2 days to help frame and develop a proposal around a practice-based study. We're continuing to hopefully support those. So we don't just want them to write the proposal, we hopefully want them to implement it now that the Nightingale Challenge has been extended, and develop those proposals into poster presentations for our annual Nurse Celebration event in December. And what leads nicely on to that now, so the end of July, we have a Writing for Publication Masterclass. So hopefully some of those practice-based studies will end up as publications, so it all kind of links quite nicely.
And Debbie, from I think we've got President Jim with us. President Jim, would you mind just going on to silent? Thank you. I think if that's great. Debbie, in terms of sustainability, do you see this now as if moving into a sort of business and key plank of your strategy around your nurse development?
Yeah, absolutely, Lisa. I think for me, we've got really good opportunities here with this, and certainly linking in with our partnership in Kenya, the learning that we've got from that and the potential to kind of restart that partnership. For me, we've got 2 places we can kind of embed the Nightingale Challenge within our preceptorship offer, but I think we've got really good opportunities to offer this now as a post-preceptorship piece of work, to continue to invest in our young nurses, continue to develop them, and continue to retain them.
Fantastic. Thanks so much, Debbie. We're now on to Julie. Julie, it'd be great to hear your story around Marie Curie early career development. And I was particularly blown by the fact that you've got your early career nurses being shadowed by your chief executive. So again, great to hear from you and your sustainability plans.
Yeah, no, thank you very much. And it's fantastic to be part of this global initiative, and lovely to be part of this event today as well. So those of you that saw my presentation from previously, you'll see that actually we have a small cohort of our nursing staff who are going through our programme. And our programme actually started much later than most of you. So a lot of our programme has been happening during the COVID-19 period. So we've had to quite quickly adapt and be quite agile about the virtual way in which we've been connecting with people, which has been absolutely fine. Just to give you a little bit of background to Marie Curie, so those of you that don't know, we are a charity in the UK. We provide end-of-life care to about 50,000 people and their families each year. That's partly in people's homes and partly in, we have 9 hospices throughout the UK. And so, and within that, we have around 2,500 nursing staff, 1,000 of whom are registered nurses. I'm really passionate about nursing staff, and this opportunity of Nursing Now actually did, and the Florence Nightingale Foundation, we're really keen on establishing ongoing sort of leadership opportunities for our nursing staff to help them with their career progression. One of the elements of the programme really was very much about the mentorship relationship, and Lisa, you mentioned about Matthew Reed, our Chief Executive, mentoring, and I think we've got lots of different people that are mentoring our nursing staff, and the way that we went about that was to really very clearly articulate what we felt the benefits would be, not only of the development programme for people, but also the mentorship relationship, which, as all of you that are involved in leadership really understand, that the leadership principles, you don't necessarily have to be from the professional group in which you're being mentored. And so we, at Marie Curie, we are, as a charity, we have involved in caring for things, in delivering care, but we also have very senior people in our fundraising team and also in our retail team. So we have lots of shops, and also we have our corporate services as well. So we spent quite a lot of time actually talking through with people and positioning with our leadership team, which is quite small. We have 5 people in our executive team, and then we have about 100 people that are part of our senior management team. And we positioned this very well in terms of looking at offering an opportunity for people to come forward to mentor the 20 nurses that we were supporting through this programme. And we didn't have to wait long for people to come forward. And so we have matched our nursing staff with a whole range of senior leaders within Marie Curie. And I think the beauty of that is that both benefit from that. Our fundraising and our retail staff and our corporate staff actually understand more about the world of nursing by actually that sort of partnership. And they also impart their leadership knowledge and experience and their wisdom, if you like, to our nursing staff. And I think for us, that's a real benefit of the way that we've approached this. And so I'd really urge people to take the sort of courage to actually position it with senior leaders within organisations. And I think there's mutual benefit actually on both sides.
Thank you, Julie. Brilliant. And again, thank you for being such a champion and a role model for this, and great to get the view of a charity and how you work across different systems. And you're making this, you know, such a fruitful experience for all concerned. So thanks so much. I think I would now like to go to President Shin. Can you hear us, President Shin? Can you hear us? Hi, President Shin.
Hi.
Hello, thank you for joining us. So the question that I've got for you, if you wouldn't mind, is there's been a positive response to the Nightingale Challenge in South Korea. What do you think are the critical lessons learnt from your experience? And how do we scale up and sustain the Nightingale Challenge, in essence, for now and forever?
Hello, everyone. It is a pleasure to be given this opportunity to speak on the Nightingale Challenge. The key concept of the Nightingale Challenge in Korea is first, cultivating leadership of young nurses. For this, KNA hosted diverse events to support the fostering of leadership and self-development of young nurses. Since 2018, we hosted 7 workshops for new nurses and volunteers on Sorok Island to teach lessons of love and sharing, Marianne and Margarita showed. Furthermore, by promoting a campaign to remember the leadership of nurses who fought for Korea's independence, we encouraged young nurses to take active actions in times of national crisis. Second, we encouraged the future nurses' advancement into the global area and their international exchanges. By inviting global nursing leaders and scholars such as ICN CEO Howard Cotton and Professor James Buchan and policymakers of Korea, we tried to provide broader prospects as nursing leaders. Also, we sponsored a student in ICN Congress 219 Student Assembly to help their advancement into global area and facilitate their exchange with those from other countries. Third, to prevent turnover of young nurses at the national level, KNA had 4 times discussions with the Ministry of Health and Welfare to support nurses dedicated to training. This is being done to prevent new nurses turnover, and we disseminated guidelines for education management system of young nurses to medical institutions nationwide. To foster the Nightingale Challenge, KNA recently carried out a survey to major hospitals in Korea and encouraged them to participate. Importantly, 15 major hospitals, including general hospitals, signed up to be registered. Their programs include promotion of leadership and training capacities and development of critical thinking, communications, and conflict management strategies to foster leadership of young nurses. To facilitate and encourage continuous employers' support for young nurses, it is critical that we came up with the scientific evidence showing now their investment leads to economic returns such as reduced turnover costs, increased patient satisfaction, and higher revenue. On the other hand, considering the lack of resources and the capabilities of small and medium-sized hospitals, KNA began development of Nightingale Challenge program of its own. Once the program is in place, KNA will proceed visiting training program for targeted hospital employers to induce their active participation in investing for young nurses. This year, 2 nurses were elected as policymakers in Korea, having their contribution to national health recognized. This is a great achievement for nursing leadership. Keep in mind that nurses are essential for global health. KNA will continue our support and urge employers' investment for young nurses, the future of our profession. Thank you for listening.
Thank you, President Shin. As ever, inspirational and so fantastic the work that you have achieved across South Korea with the Nightingale Challenge. Long may it continue, and we look forward to working with you. Now I'd like to go to Howard. Hi, Howard. It's a real treat to have you with us. Thanks for joining us.
Hi, Lisa. Hi, everyone. You can hear me okay?
Yeah, you're looking and sounding good. So the question that we've got for you is the leadership development was on the agenda again last week at the Triad meeting. Would you share with us what came out of this meeting and how health employers can best respond to this agenda?
Very happy to. Thanks, Lisa. And firstly, let me congratulate you and Nursing Now on this 1 year anniversary of the fabulous Nightingale Challenge as part of the work that Nursing Now have done. Let me just paraphrase Mark Twain. The reports of the demise of nursing leadership, I believe, have been greatly over exaggerated. And the reason I say that, Lisa, is in part because of the meetings that we were at last week in Geneva, the Triad meetings. For folk who aren't sure what they are, WHO with ICN and the International Council of Midwives bring together chief nursing officers, midwifery officers, regulators, association leaders every couple of years for some really important business meetings, which are called the Triad meetings. There were 500 leaders of nursing from around the world who participated in those meetings, those virtual meetings last week. But what I heard so clearly from all of them in their interventions was the phenomenal leadership that nursing right around the world has been showing in response to coronavirus. You just heard from President Shin, and Korea have been absolutely, the Korean Nursing Association, at the heart of the government's plans to respond to coronavirus, and that's happening in many places. And I've just joined you, having come from a call with the World Health Organization for the European region, and their regional director has confirmed a commitment he gave to ICN before COVID broke out, that they would appoint a chief nursing and midwifery officer at the European level in Europe. And he just said that again on a webinar that he's talking to the 54 member states across the European Union. So nursing leadership is absolutely alive and kicking. And I think that we should be really positive and optimistic and be proud and promote that. But there are some things, Lisa, which I think that we should pay particular attention to. You've heard, State of the World's Nursing has been published, and investment in nursing leadership, nursing education, improved nursing jobs are three really high priorities. But there's a couple of interesting stats in that report. One is in terms of the number of chief nursing officers that there are in the world at the moment. And countries have reported about 70% of countries say they have chief nursing officers. But if you dig beneath that number, sometimes the person may have a title but might not necessarily have the budget, the authority, the responsibilities to really be effective in that role. We need to get more into some of the weeds and the detail as well of these positions to make sure that we not just have a title, but we have people who have the authority, the responsibility. Tied to that, we need to have the development programs to bring people on. That's why the Leadership Challenge is of course such a wonderful initiative. But there's another interesting stat in State of the World's Nursing. It highlights that nurses and midwives make up about 59, nearly 60% of the total global nursing workforce, but we only spend about 25% of education budgets on nurses and midwives. That can't be right. And clearly, if you haven't got the money, that's one major impediment to having the leadership programs, which are going to prepare people to then go into the posts that we want to see. And one of the other issues I just flag, and this came out very strongly from the Triad meetings as well, there'll be a consensus statement with the outcomes from that meeting, I hope very soon. It will talk about the importance of leadership, but it will talk about the importance of leadership at all levels within health systems. It's not just about chief nursing officer posts. It's at all levels. And I'd say a challenging point or observational reflection from me. Lisa, you and I know from our days in different roles in the UK, where we really spent some time focusing on the importance of the ward manager, the ward sister, and how critical they are to high quality healthcare. Do you know, sometimes I think that we let others talk about managing health services as though it's completely divorced from nursing. Managers and managerialism is not what nurses do. It's something different. It's a technical skill in its own right. There's often some gender politics about men who are going in there and making tough, hard decisions. Look, I sort of think that's crap. I'm sorry, that's probably not an internationally. Don't quote me on that, anybody. But look, I think it's nonsense. But I think that we're partly at fault for letting that myth, that nonsense, perpetuate. I think that we need to be saying, look, what's at the heart of what nurses do, where they assess, they reprioritize, they're ensuring quality, they're ensuring safety, they're the point of customer contact. I know we don't call our patients our service users, our clients, customers, but thinking about that managerial terminology, that's absolutely what our nurse managers do as well. So I think we should be reclaiming, not just being proud and promoting what we see nurse leaders doing, arguing for the positions, arguing for the budgets, arguing for the responsibilities, but also reclaiming some of this territory. There's nothing dirty or different about managing. It's at the heart of good nursing care, I would contend. So there you go, Lisa. Back to you.
As ever, Howard, thanks for inspiring us, educating and entertaining us. I think you do all three of those so beautifully, and really appreciate your leadership and support with the Nightingale Challenge. So it's great partnership working. Thank you. We now move to Amna. Amna's been with me already this morning. Amna is one of our Nightingale Challenge nurses in Qatar, who is really championed by her chief nurse, Dr. Nicola Riley, who we heard from earlier. Amna, the question that I've got for you is, how has the impact of the Nightingale Challenge, how can we sustain and scale it up with employers and convince them to keep investing in the leadership development of early career nurses?
Hello, everybody. I'm very happy to join this session. I think I am the less senior in this group. Actually, it was my pleasure to be in Geneva last year, WHA, and to name this year the Year of the Nurse and Midwifery. Actually, the Nightingale, it's supporting all new nurse leaders, not from all levels, starting from the ward charge nurse or a head nurse or all type of leaders, and that's what we need. Actually, we started the Nightingale Challenge from February here in Qatar, and it was actually they started the training us in leadership courses. The Florence Nightingale Foundation, they came to Qatar also, and they developed us some courses. After that, when we are in the process of the mentorship and all, they started to appear. I don't know, but it's a chance to prove that all levels can function. Even the like staff nurses, they function as a leader on that time. Even like a lot of staff, they become sick that time, affected by COVID, that we need another nurses to step up as a charge nurse or to rule the unit that time. A lot of facility opened, that they need a lot of nurses to cover all this hospital, and they need leaders for the whole expansion. I was very confident because of the courses we taken before and the networking that I had, and we developed that anything I want to check if I am doing this is wrong or this is correct. I have people with me to support me and to ask them, am I doing the right thing or no? And this is the power of the mentorship that time. We were all as one team in nursing, and that's what we need, that all the nurses, like we are living in one village, we know each other, and we are supporting each other.
Yeah. Thank you so much, Amna. And certainly from our conversations with Nicola and yourself, I think one of the things that will be sustained in Qatar is the networks that you've built, working closer together, sharing and collaborating. And I just thank you for being on this panel with us today. And whilst you might not be as senior as some of the others, you are absolutely just as important, if not more important, because you are the future. Thank you for joining us. I'd just like to, if we can, return to Peter for a moment. Peter, in terms of the state of the world's nursing, you've been working, I think, very closely with colleagues on state of the world's nursing. Is there anything else that, how do you see the recommendations of the state of the world's nursing and the Nightingale Challenge? Where is the coming together of those two things? And really quickly, because we've not got too long together, so sorry to put you on the spot. But what are your thoughts about the alignment of what we've been trying to do and what's recommended in the state of the world's nursing?
Thank you. And just building on, following up on what Howard said, I mean, the time is now. This is, we've clearly identified the problems, but the State of the World Nursing Report, unfortunately, will be a document that looks really nice on people's shelves if it doesn't turn to action. We are working right now with WHO to develop policy dialogue, national policy dialogue support. And WHO has a goal of policy dialogues in 100 member countries. I think that the key really is now nursing leadership within their countries, meeting with a broader range of stakeholders, looking at the State of the World Nursing Report from their country profile to the report that's coming from the Triad meeting that will, that's done. I think a global analysis of what the State of the World Nursing Report means moving forward, and really pushing for investment, separating out those things that we can do tomorrow, that we can do right away. For example, making sure that chief nursing officers have the tools the leadership tools that they need, that they have a true seat at the table. And then looking at those things that are going to require longer term investment, perhaps advocacy for donor dollars, in order to be able to move forward. We have I think Dr. Tedros at the International Day of the Midwife said, this is not the year of the nurse and the midwife, this is the beginning of the decade of the year of the nurse and the midwife. And if we're going to meet our UHC SDG goals in 2030, this is our time. So nursing now is perfectly placed.
Yes, I think you're absolutely right. And I think, reflecting on Howard, reclaiming some of the ground that we may have lost or not put enough emphasis on, I think is another key opportunity. I don't know if Chris can hear us. Chris Beasley, can you hear us at all, or are you struggling? I think maybe Chris is struggling with technology. Chris was kind of gonna wrap up for us, but I think she's probably struggling with it. I mean, in terms of what I've heard, and I don't know, Catherine, whether you're keeping an eye on the chat box, whether that's possible, in terms of summing up what we've heard. I mean, what I've heard is not only have people really embraced the Nightingale Challenge, but they do see a way forward to sustain it and see it as part of sort of core business to their sort of nursing leadership strategies within their organisations. I think there's a crucial element that really still needs to be nailed, though, and I think that is about building that global network, creating those partnerships, and enabling early career nurses and midwives to talk, to connect, to listen, to learn, and provide solutions for each other. Because I think the peer community is so potentially powerful, and just listening to Amna and other early career nurses and midwives that have been given the opportunity to undertake a leadership development program that's been completely sponsored by their employers and backed by their organisational leaders, I think has such power and such relevance to today's challenge. I think, Howard, the state of the world's nursing, we need to sweat every statistic in that document to raise the profile, raise the level of investments, and highlight this profession and what it can do if it's taken seriously and invested in. So I just want to say a huge thank you to being amongst such formidable leaders on this virtual call for this last hour. I've really enjoyed it and learned so much from you, and really appreciate your support, your friendships and your challenges. So thanks so much for joining, and I hope you enjoy the rest of the conference. Thank you.